Good afternoon and welcome back to Facebook Live here on the Oneida Nation Reservation. It's Monday, June 6th, and I'm the Public Relations Director, Bobby Webster. I hope everybody had a safe holiday weekend and got a few announcements before we get started with our guests today. As of July 12th, there's a new standard operating procedure for the Oneida Nation employees. And it will be in effect on July 12th, and that's in regard to wearing face masks. So as you see today, I'm getting a little challenge, not getting fogged up and making sure that I can still see through my bifocals. Masks will be required in instances where they are unable to safe distance from one another. The new policy is going to include different levels of risk. And according to your supervisors, they will advise when it is absolutely required. And then there are times when you will not need to wear a mask if you're not in association with anybody. My office is on the 3rd floor. I'm in the office by myself most of the day, rarely see anybody. Masking is not required. I come into a meeting situation, it changes. A mask is then required. So that policy will be communicated out to the organization. I know a lot of people have asked about why we're not masking, when we're not masking, etc. Another announcement today, Oneida Bingo and some table games will begin tomorrow. So they are going to have basically the same schedules and the same types of games that they had prior to the closing of the operations. They're going to open sales up an hour early just to make sure that we get everybody in there. The games will start as usual, as they were per schedule previously. There will be no fry bread heaven at this time. No smoking. Masks will be required. Plexiglass is in the bingo hall and on the table games to separate the patrons, as well as temperature checks for entering the buildings. The capacity for bingo is 365 seats, and for table games at this time, 50 seats. So I know people have been waiting and excited for that to take place, and that's coming just around the corner. Continuing to fog up. This Friday, July 10th, the Food Distribution Center on Water Circle Place will also begin resuming their grocery box distribution. That's under the water tower on Highway 54 Oneida, the food distribution. People will be there to direct traffic. The distribution will start at 10 o'clock on Friday morning, and it'll be the grocery boxes as before. So today with us, we have Michelle Myers, who's our public health officer, and she'll be giving us our update on the COVID. Also with us, we have Debbie Santiago and Leah Foos, who are nurses with our Oneida Community Health Center. They're going to give us some information and updates on contact tracing and some of the COVID issues. And then finally, Rita Ryder from HRD will be joining us. Rita's going to talk about some of the challenges that people have been facing in applying for unemployment. So with that, I ask you please to make sure that your questions stay relevant to the subject matter today. Be respectful, and solutions are always appreciated, suggestions and solutions. And as always, we have distanced ourselves, we have sanitized our surfaces, and we're masking. So with that, I'll ask Michelle to please give us the update.
Thank you, Bobby. So we'll start with the numbers. Globally, there are 11,471,225 confirmed positive cases. In the United States, there are 2,888,729 confirmed cases. For Indian Health Services, there are 21,245 cases. For the Bemidji area, 368. For Albuquerque, 1,129. Navajo, 8,578. Phoenix, 5,445. For the state of Wisconsin, there are 31,577 cases. With that, there are 796 deaths in Wisconsin related to COVID. For Outagamie County, we have 540 total confirmed cases with 9 deaths. For Brown County, we have 3,018 cases with 42 deaths. Now, specifically for the Oneida Reservation, in Brown County, we have 21 cases, no one in isolation, no deaths. And for the Oneida Nation in Outagamie County, we have 29 cases, 2 deaths, and 1 still in isolation. So we want you to be safe as you go through this summer. So I'll share some reminders for what you can do to stay safe. Stay at least 6 feet away from people as much as possible. Frequently wash your hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing. And then when soap and running water is not available, to use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, or mouth. Always cover your mouth and nose with a tissue when you cough or sneeze. Wear a cloth face covering over your mouth and your nose. Stay home when you're sick and avoid unnecessary travel. Just wanted to take a few seconds to review the symptoms of COVID. When should you call your doctor if you think you've been exposed or are experiencing any of these combinations of symptoms? Cough, a new onset or worsening of a chronic cough. Shortness of breath, fever, chills, sore throat, runny nose, muscle pain, headache, or loss of taste or smell, a new loss of taste or smell. So not everyone with COVID-19 has all of these symptoms. For many, symptoms are mild with no fever, but some may experience fever, fatigue, nausea, or vomiting. So for these reasons, because cases can be mild, this is why we wear our face coverings. It's important, when I wear my covering, I'm keeping my germs to myself. When you wear your face covering, you're keeping your germs to yourself. This only works if everybody's using the coverings. So it's important that you wear it on your nose and your mouth. If you pull this down and expose your nose, it's not helping. You need it on your nose and your mouth. Don't put it on your forehead, put it under your chin. And whenever you're in public, or as Bobby mentioned, you can't social distance, make sure that you have something on your face. So with that, I would like to turn it over to Debbie to kind of talk about what happens with contact tracing.
Thank you. Good afternoon. I am Debbie Santiago, and I am one of the public health nurses at the Oneida Nation Health Department. With me today is another public health nurse, Leah Foos. So thank you for joining us. Our goals this afternoon are to inform the community and others watching what it is we do at Public Health in regards to the COVID-19 pandemic, and to share how our coordinated efforts help in preventing the spread within the Oneida Nation community. Under the supervision of the Oneida Health Officer, Michelle Myers, the public health nurses have been working the past couple of months doing the important work of contact tracing. So contact tracing is a process public health uses to identify people who have tested positive for an illness such as COVID. Contact tracing also helps identify other people who may have been exposed. It is one of the most commonly used tactics to control the spread of any communicable disease. So when the Oneida Nation Health Department receives notification of a person with lab confirmed COVID, one of the public health nurses will conduct a case interview. This is a phone call to the individual to ask about symptoms, provide education, and find out where they could have been exposed during the previous 2-week period. This helps us try to determine the source of the person's exposure. These questions sometimes lead us to identification of other persons who may have been ill. An example of this might be a gathering, such as a bar or a wedding, where a few people had symptoms, but it was not yet recognized that COVID was spreading. So we will also ask about places that the person with COVID may have been recently and people who they have encountered while they were contagious. The time frame for these questions is 2 days before their symptoms started and any time up until the day of the interview. The nurse will also discuss isolation and quarantine instructions and symptom monitoring for the positive case and all household members who are considered to be high risk. It's important for these people to isolate by staying home, avoid going to work, school, or any public areas. The public health nurse will communicate with each of these people often to monitor their symptoms day by day and to assist with needs related to their time at home. Everything that public health discusses with all people involved is confidential, and we are not allowed to publicly share that information by law. We need to protect the privacy of all individuals. So now Leah will talk about the next step in the contact tracing process.
Thank you, Debbie. Once we have the names of the individuals that came in close contact with the person with a known case of COVID, public health will then call those people and ask them questions about their symptoms, give them instructions on quarantine or isolation, and the need for possible testing. To clarify, isolation is used for those people who have tested positive for COVID, and quarantine is meant to keep someone who has been closely exposed to COVID away from others, even though they may not yet be sick. Sometimes close contacts become ill later, and sometimes they do not. By isolating COVID positive people and quarantining those who have had close contact with positive cases, we can prevent the spread of COVID to others within the community. All contact tracing case interviews happen over the phone. During this process, we have found that some people are hesitant to answer incoming calls when they don't recognize the phone number. We in public health encourage people to answer incoming phone calls and answer the questions asked by public health nurses as honestly as possible. Public health has also been made aware of contact tracing scans in the area and would like to remind the community that an actual public health nurse will not ask you for any credit card information or your social security number. State and local health departments have access to a secure electronic system where information we receive from the interviews is documented. We can monitor cases and review any COVID symptoms to determine when the person should be released from isolation or quarantine. We work closely with the individuals to make sure that they understand the information that is provided to them. The goal of contact tracing is to prevent additional exposure and spread. Along with social distancing, wearing a mask in public, covering your coughs and sneezes, and staying home when you are sick, we all play a role to prevent the spread of COVID. The Oneida Public Health team wants to thank everyone we've worked with during these past weeks. We understand that isolation and quarantine time at home is difficult, but following these instructions are important to prevent the spread of COVID in our community.
Thank you very much, Leah. And now, Rita, we've had a number of questions coming in about individuals who are having challenges with unemployment. So Rita Ryder from HRD is going to address some of those issues.
Wages-free Oneida Nation. We have been experiencing some questions in regarding unemployment. Currently, we have 999 employees as of 6/20/2020, employees collecting full-time benefits or partial benefits. One of the biggest challenges that the employees are having is when applying for unemployment benefits, the state goes back for 18 months. So in the 18 months, they look at every employer. So that you will then be assigned an adjudicator, and then at that time, there's an investigation of what if it was a quit, a termination. So sometimes that may be holding back the benefits as well. Employees can collect the COVID pay, which is separate from unemployment benefits. So if they don't qualify for unemployment, they may qualify for the COVID pay. And the COVID pay will end on 7/25/2020. So if you're still in adjudication, they will back pay you that amount. So eligibility questions in regarding unemployment is if you are called back to work and you deny work, that is an eligibility issue with unemployment. So we are notified weekly of the claims that are submitted by our employees. So if we see that there's 0 hours, but the employee worked hours, we need to report that to unemployment. HRD-EEO verifies all wages with the state of Wisconsin. So there is many different ways that we don't report the wages, and that is if there is retirement or if there's a quit or termination, we still have to notify unemployment of that. So if you do have any questions in regarding unemployment and have not received your benefits, I know some employees have not yet, and it's been, 10, 12 weeks, please contact our office. But also you can go to my.unemployment.wisconsin.gov if you haven't even applied yet and follow the prompts. If you do have questions in regarding your claim, you also can look on your account and look at the dashboard, and it will also give you information. It's really important that you look at the dashboard, and I'm steaming up here. Look at your dashboard and read all the messages that you receive. Also is to job service and job search are totally different things. You need to apply for job service. That is a requirement, and if you don't apply, you will, they will hold your unemployment benefits. If you have any questions, concerns in regarding your unemployment claims, it is the state unemployment office that actually makes the determination. EEO, HRD does not make that determination in regarding benefits. So it is always the state of Wisconsin who makes that determination.
All right, thank you, Rita. We have a couple questions, a couple for our nurses, and that is, how receptive are people when they're being contacted for contact tracing?
Most are responding pretty well. They answer all of our questions, and sometimes they're hesitant to give us who they've all been around, but we encourage them. We really need to know every single person that you would have had contact with in order for us to be able to call them to give them instructions. So people are being pretty receptive.
They also are pretty receptive to giving us the contact information for those people that they have been in contact with, and sharing where you have been. We are not in any way, shape, or form trying to get anyone in trouble if they have been out. We are just looking for the possible cause of their exposure or where the exposure may have spread to. So we don't punish anyone for telling us, oh, I went to Walmart or I was out. We just need the information so that we can follow up with the appropriate people.
And once you talk to them about the contact tracing, what's the most important detail that you need from them? Is there a time frame they should cover?
Yeah, we really want to know, when did your symptoms start? What day exactly did your symptoms start? Because then we look at 2 days prior to that. So were you at work? Were you at a gathering? And when I say like symptoms start, it could be anything like a sore throat, a fever, a cough. So that's really an important date to kind of remember. If you do start to see symptoms right away, call your provider, go get tested, and then it's really important to stay home.
And if nobody answers, you're calling them and they don't recognize the number, so as you said, sometimes do you leave a message?
We do leave a message, or we call back. Some of us have work cell phones, and we leave a message also that identifying ourselves and saying, if you're not comfortable talking, you can text, or you can call our office phone numbers as well.
And that number is?
It depends on who's calling. Our general community health number is 920-869-4840, and that will get to the community health administrative assistant, and she can forward to the nurses.
Okay, thank you. If a tribal member from the reservation does a test at an outside facility, will that information be shared with the tribe, or does that remain outside of your jurisdiction?
So it depends on if the person lives on the Oneida Reservation. So we're getting all the cases that live on the reservation, even if they were tested at Aurora or tested at Belen, it doesn't matter. So as long as they're Oneida enrolled and on the reservation.
Okay. For Rita, let's see. Oh, I lost the question. Hold, bear with me. Okay, I'm sorry, I lost the question. Some of the other questions that I had a chance to jot down were about our food, our restaurants, at gaming, Frybread Heaven, and the Lodge. We do not have opening dates at this time. When we find out when those are ready to open, we will advise you. In addition to that, I'm sorry, this is not cooperating. In addition, at bingo, you may bring in your own food and beverage at this time. They realize a lot of people are diabetic. A lot of people do need to eat and maintain their sugar levels, etc. So you will be allowed at bingo to bring in your own food and beverage. However, you will not be allowed to bring food and beverage into any other casino outlets. Let's see. Same thing about opening of the Lodge. They do not have a date for opening of the Lodge or Frybread Heaven at this time. All right, let me see. Rita, I believe this is employment related. Maybe you can help. Everyone that has received a letter back in March saying they were furloughed, will they be called back before the cutoff date from unemployment, which is, I think you mentioned, is July 25th?
That is for the COVID pay. That's not the unemployment. That's not the 26 weeks. So that is for the COVID pay. So if you're not eligible for unemployment and you're unemployed, they still may be in adjudication. That means that you still may be eligible for unemployment benefits. I mean, not unemployment benefits, excuse me, the COVID pay. Totally separate from unemployment benefits.
Okay. I guess all of the questions related to whether and when people will be called back, employees, that's all going to be dependent upon each area. It's going to be depending on whether or not there's funding. There's some state and federal funded programs and operations that allow for individuals to resume employment. In cases where they were funded by the tribe's budget, those individuals will it'll be subject to when the funds are available. And as we know, our recovery is going to be very slow. It's going to be a difficult recovery because we do have to invest a lot of money into recovery. There's a lot of things that we have to purchase, that we have to make changes, and we know that there's money available from the federal government for those PPEs and PPPs for in tribal employment and recovery. However, it's not always available immediately. It's not always, it's a plan. It's a plan in action right now. So we're doing the best that we can for recovery. Employment is a very important component of recovery. However, until we can solidify our finances and get back into some sort of a normal mode of operations, it's going to be very difficult to determine who, when, and what time they'll be coming back into the workforce. What phase of callback are we in? We're in phase 2 of some operations and in phase 4 and tier 5. So there's different phases for different operations as well as tribal budget. So it's kind of hard to determine. We might be able to pull something on the website relevant to that. So we want to thank you for your questions today. I do apologize. There's some comments about having some difficulty with the masking on and understanding what I'm saying, so I'm going to kind of hold it. This is a no-no though. You should not be wearing a mask and holding it. You should not be wearing a mask like this. You should not be wearing the mask like this. You should not be wearing the mask like this. But for the purposes of finalizing our comments today and saying goodbye, I'm going to untangle myself a little bit, so if you bear with me. Trying to maintain the safety. Our numbers are not subsiding throughout the United States. We're not very lucky outside of our reservation on the numbers going down or maintaining or flattening out. However, we are proud of the work that the Oneida Nation is doing. We want to remind everybody to do the social distancing, the sanitizing, the masking. We had a discussion earlier today where we're talking about our children and our grandchildren who are telling us, you're supposed to wear your mask, you're supposed to wash your hands, you're supposed to stay away from people. So if our children are getting it and they're reminding us, then we need to get it. We need to be the role models. And as I said, I do apologize for the difficulty. I'm going to have to try to find a mask that allows me to speak a little more clear, and that maybe I need a bigger mask or smaller lips, but I'll work on it before Friday and hopefully get better at this. We want to remind everybody that going out into the public, being safer at home is the wise thing to do. When you do go out, just remember the rules, please. Don't bring that COVID back home to your families and to your children. So be careful, be safe, be healthy, and as a reminder of our core values, we're Oneida. We seek to be one with all creation, to be grateful for all the earth and all she provides, and to attain harmony with oneself, one's family, our neighbors, and all humanity. So continue to stay with us in our prayers and to keep our community safe and healthy. Yawon go, o kali skana.